Welcome back on the AM show. Let's turn our attention now on this bizarre incident that has left many shocked and raising questions of professionalism in our health delivery system. A patient was found abandoned to death at Ojobi in the central region. This morning, we are simply asking what went wrong. My guest joining me for this conversation, Dr. Anthony Siasari, the Presidential Advisor on Health and former CEO of CATH. I've also been joined by Professor Titus Bayo, professor at University of Ghana Medical School and former General Secretary of the Ghana Medical Association. Gentlemen, thank you so much for spending parts of your holiday morning with us.
Thank you. Good morning.
Good morning. In the course of the conversation, we'll be joined by other guests, but I'll start with you. But I want to start with Dr. Anthony Siasari first. Doc, I want to dip into your vast pool of knowledge. I mean, you've held so many positions, CEO of CATH, Director General of the Ghana Health Service, and now Presidential Advisor on Health. From your professional perspective, in terms of the architectural structure of operations in public hospitals, how does the system work, or what went wrong in this situation?
Thank you very much, and good morning to your cherished listeners. It's an unfortunate situation. I was sad when I heard it. From my experience, what happens is that normally, we work together with the social welfare department. In fact, in Konfarachi and the bigger hospitals, they have a unit within the hospital. And I'm sure Winneba Hospital also have a unit. If we had a unit where we have some social welfare workers which were seconded to us, and we even had somebody who was employed and trained to lead the unit. So what normally happens, we have somebody who is a pauper or someone who doesn't even know where he's coming from. We hand over that patient to the social welfare unit, and they will start working with the patient and with the nurses and the doctors in the unit or the department or directorate, as we used to have it in Kokwanachi, to make sure that the patient is followed up. And then we get in touch with the village or the town that the patient comes from. We try to get in touch with the assemblyman, the chief, and the people in that village. And after a lot of interactions with the village head or the town head or the assemblyman, we normally will get the problem sorted out and find the relatives in that village or town. And we continue looking after the patient for free. Because
for free, you said? Also, Doc, did you say for free? Okay.
Yes, because if it's a pauper, he doesn't know anybody and the relatives are not coming forward. You have to treat the patient, and that is supposed to be the case. It's not everybody who comes to hospital who can pay. So we have what you call a paupers list. Or what the management have to do is to keep good records of that patient so that you can explain, because auditors also will come and ask later on why this patient maybe has not paid. Because, if you look after a patient, it's either the patient has a health insurance, if what is being treated for is fully covered by health insurance, or the patient pays. Or if the patient doesn't pay, somebody pays. So you, as the head of the hospital, keeps the records and then lists it as a pauper. And that is what we normally do. So when the patient is discharged, we then find a means to take the patient to the appropriate location, hand over the patient to either the relatives or to the assemblyman or to the chiefs. I have a location in Kopanachi where we have to take the patient directly to the chief, ask that the patient should be brought to him. And when we took the patient there, he asked the social welfare unit to wait. And the chief managed to collect donations from all the people who were gathered there to come and pay the bills. But we asked that he should keep the money for the upkeep of the patient. And the chiefs continued to bring the patient to the hospital until the patient was declared fit and discharged. So that is what is supposed to happen in every hospital. But I'm happy that the Ghana Health Service has now set up a committee, high-powered committee, chaired by the Deputy Director General of Ghana Health Service, to look into this case. And I'm waiting, and all of us should wait patiently for the outcome so that we know what actually happened there, so that we set the systems proper. I take it as a systems failure. And when the system is put in place, I believe that that is what every Ghana Health Service institution will then follow. Because there is a system there. That's as I've explained to you. But sometimes systems fail, and that's exactly what happened in this situation. Very unfortunate,
right?
Especially the death of that unfortunate patient. And I think when the system is set up after the committee meets and find out the causes and everything, we will not have this situation again in this country.
And Doc, from the system that you just outlined, if, I mean, the family of the patient is absent, you can go to the chiefs, like you mentioned that there was a situation like that. In this case, under what circumstances could a patient be completely abandoned like that? What in your vast experience do you think could explain why this woman was left abandoned in her state the way that we have seen, which subsequently led to her demise? What could have accounted for that?
I cannot tell, but I suspect that maybe he has a mental derangement. It may be the cause. Because he had an accident, from what I've heard, a few things that I've heard about the patient. I think a vehicle knocked the patient down and ran away or something of the sort.
So if the person is mentally unstable, is that reason enough for them to remove the person from the hospital premises of the hospital, like we have seen?
No. When the patient is mentally deranged and then he has an accident and he's managed and he's out of the danger, the appropriate place is to send the patient to a psychiatric hospital. That is fair. Secondly, I believe that the patient was managed because I saw two POP on the two legs.
Yeah.
And what actually maybe went wrong, that they should have done an in-depth investigation to find exactly where the patient comes from, if the patient maybe have to be sent home. And luckily, we have assemblymen who are very up and doing. So the social welfare department in the district should have been working closely together with the social welfare unit in the hospital, so that they find where the patient actually comes from before the patient is discharged home or discharged and handed over to the assemblyman or to the unit committee or to the chief. That, to me, should have been the proper thing to have happened.
All right. Doc, please hold for me. Let me go to Professor Titus Bayu, and I'll circle back to you. Prof, thanks for staying with us. You've joined the conversation from the start. First of all, how does this whole situation make you feel? What is your assessment of the situation? And then we'll get into your professional perspective of what went wrong and how it was fixed. But first, how does this make you feel?
Good morning, and let me say a very good morning to my senior colleague, Dr. Nsiah-Sarri, and Ebaka Desala to all our Muslim brothers and sisters. I think it's a very, very, very sad situation, very worrying, and it should not happen. And I should agree with my senior that this is a serious failure of the system. It should not happen to anybody. I can confirm the system that he has narrated. A similar thing happens in almost every hospital. But to have the patient left unattended to at that point, there's a serious break in communication somewhere or a systemic failure of the linkage with the community. From what I have learned so far, it looks like the hospital care was good, but that transition from hospital care to the community is where a major error would have occurred, which is unacceptable. But I just hope that the investigations, as Dr. Nsiah-Sarri has mentioned, will bring this to the fore and help correct the system, because this should not happen to anybody, whether you are mentally sound or not, whether you are destitute or not. The hospital should be a safe place for anybody. And if you are moving from hospital to the community, there should be a continuum of care. And it's the reason why we have the social welfare services attached to the hospital. So for something like this to happen through the three institutions, i.e. the hospital, the ambulance system, which I think is associated with the hospital that led the patient there, and the social welfare services need to do some thorough explaining for us to know exactly what happened.
Okay, so now before we delve into the actual issues, this medical director, Dr. Pra George Kwame, who's been relieved of his duties because of the investigation, has released a statement. And please indulge me, I want to read everything so that we have a clear understanding of what he says happened, from his perspective. Now, reports on an incident involving an unknown person brought to Trauma and Specialist Hospital on the 29th of May, 2024. On the above-mentioned date, the National Ambulance Service called the social welfare officer at the hospital to inquire as to whether the hospital was ready to accept an unknown knocked-down person by a hit-and-run driver, and the response was in the affirmative, which means, yes, they said they were ready to receive the person. The victim of the accident was brought to the hospital by the National Ambulance Service, accompanied by the social welfare officer of the Gomwa Ojobi, and treatment process started in earnest on the same day. Just like you rightly mentioned, there's always social service involved. Now, after the necessary examinations were done, plaster of Paris, that is a POP, was cast on both lower limbs of the patient due to fracture on the tibia bones. The hospital, as usual, took absolute responsibility for feeding, medication, and housekeeping of the patient. The patient had been on admission for 6 days and finally discharged on the 3rd of June 2024 after being declared well. The medical record is tendered in as evidence. So the patient was actually discharged. That is what he's saying. Meanwhile, based on the outcome of the interaction between the social welfare officer and the patient, it was established that the patient hailed from Gomwa Ojobi community, and that also confirmed where the national ambulance picked her up. At certain point in time during the treatment process, the patient became disoriented and started to exhibit some amount of violence. However, after gaining some strength and consciousness, the patient was calm and wished to have been sent back to where she was picked up. Moreover, after the patient was declared well by the clinician, coupled with the fact that she was itching to leave the hospital, a consensus was reached by the two social welfare officers to send her back to Gomwa Ojobi, as agreed by the two social workers. At this juncture, the hospital ambulance, accompanied by the social welfare officer and a staff of the hospital, were detailed to transport her accordingly to the preferred destination of her choice, after clothing her nicely and made available to her a wheelchair. Again, before the departure from the hospital to Ojobi, the social welfare officer interacted with his counterpart at Ojobi to inform her that the patient was being brought back to Ojobi, and she assured them of the takeover. Sincerely speaking, if one should objectively analyze the situation at hand, one would realize that the hospital had played its role as expected of it by taking care of the patient, empathize with her, but unfortunately, the inevitable occurred. It would interest the public to know that Trauma and Specialist Hospital, Winneba, is being operated by well-trained health professionals and will not, for a moment, disconduct themselves to dent the corporate image of the Ghana Health Service and its own image as a secondary referral facility. Furthermore, mention should be made clearly that this had not been the first time the hospital had played good Samaritan role by taking care of patients of such caliber and delivering them back safely to their community after getting well. Records are also available to authenticate the veracity of this claim. Management would like to appreciate the sentiment expressed by the public regarding this unfortunate incident. This is a learning curve and a bitter lesson to learn, and promise not to repeat it again in the life history of the hospital. What I want to focus on, Dr. Nsiasari, I'm back to you now, is that he's saying that the hospital did everything possible to ensure that the patient was well cared for. But in the architecture that he just laid out, there's obviously a disconnect. So by the narration that we've just read, that, the medical doctor said that, well, they took care of her. She was there for 6 days. She started showing violent behavior. Social welfare, Ghana ambulance service accompanied her. She actually requested to go back to her community where she was picked up from. Now, they're saying that she was not mentally stable. Should they have heeded to her call to say that she wants to go back to where she was picked up from? What went wrong in all these narrations that we are seeing now, Doc?
Yes, if you listen to this narration, which is well written and articulated, I believe that the missing link is a connection between one. The hospital should have a psychologist or a psychiatrist to at least see the patient. I didn't hear anything about that. Two, I believe that the missing link, which was not properly done to continue the care of the patient, is the link between the hospital or social welfare unit and the counterpart in Ojobi, the one who referred the patient and brought the patient to the hospital. I was expecting that the social welfare unit of the hospital should have handed over the patient physically to the social welfare unit or social welfare service at Ojobi. If it had been done in that way, we wouldn't have had this, or be discussing this unfortunate situation. And that's where the problem is. So questions should be asked. Where was the social welfare service personnel who brought the patient to the hospital from Ojobi? Ideally, you should have even have come to the hospital and then joined the ambulance to take the patient safely where the patient was supposed to be taken to. To me, that is where the problem is. But the investigation which is being conducted will come out of all this. And two, the lesson that we have to learn from this is that if the patient is exhibiting some mental issues, because he was knocked down by a vehicle, maybe we should have also dealt well into the psychological and then the mental patient. But all being I'm happy that the hospital took very good care of the patient. They did what they are supposed to do. You know that the Winneba Accident Hospital is not a rehabilitation center. It is an acute hospital because the bed which the patient was lying on is a very, very, very important bed that has to be used for other patients who maybe have an unfortunate situation and sent to the hospital. So the hospital have a number of days that they have to see such a patient, and they have to then relieve the patient out. That's why we discharge patients. If you are not very careful and you don't act also very quickly according to the laid down regulations, you keep a patient in the hospital and it becomes a convalescent hospital, and it is not. These hospitals are all acute hospitals. And that's what the doctor is saying, that they do exactly what they are supposed to do as accident hospital in that part of the country. And I believe that the missing link is that. So we haven't heard from the social welfare unit in Ojobi. I'm sure the investigators will call him or her to find out what actually went wrong. But as I said earlier, this is a very simple issue. The social welfare unit in Ojobi and even the hospital social welfare unit should have also have contacted the assemblyman or the unit committee chairperson in that area, and the chief for that matter, and find out exactly what they should do, and where they should bring the patient to, and where they should come and drop the patient, but not at the outskirts or in the town. If you drop the patient in the town, who will take care of the patient? That's where the problem is. So I'm very certain that all the in-depth investigation is going to go on will bring out all this into force, so that the Ghana Health Service and the social welfare services in the country will then sit down again and then maybe come out with a very well laid out conditions and what a pathway should be like. Because social welfare is for the people, the hospital is also for the people. So the two should work closely together and find out this solution to these issues. I also know there are some even homes run by some religious organizations and others who will also accept such patients. So if patients should have been entertained and then they have done a thorough work, all these things will not, unfortunate situation, not have happened.
So in this case, the social welfare, they are the ones who failed this woman. Is that what you're saying?
The social welfare system failed the woman.
Okay.
The system, not the person. The system failed. So the system of the discharge, the management of the hospital was well that the patient was well discharged and documented. What failed was the transport of the woman from the hospital to the community, which normally is done by the social welfare unit in the hospital and the social welfare in the community. That's why they are there.
Right.
And the social welfare in the community, if he has any problem, should have sought the assistance of the people, the leaders of the people in that community. That is the assemblyman, the unit committee chairperson, even the MP of the area, and then the chiefs and the queen mothers of the area. I'm very certain that if this would have been done, there would have been a very smooth transition of the patient from discharge to home.
There have been, the Ghana Health Service has launched an investigation into this matter. And there have been calls. I heard Mary Ada of Ghana Integrity Initiative saying that, do we really need 30 days to conduct an investigation before we understand or we gain clarity on what happened, and then we can start to maybe prosecute or take some action against those who were involved or perpetrators of this crime, if you want to call it so. My question to you is, do we need 30 days to conduct an investigation to this matter? You yourself in your submission said this is a simple matter. So do we need 30 days?
I think what Ghana Health Service letter, the communicate that the issue was that the committee has been given 30 days. So I see that as within 30 days. You may not need 30 days. It may be less than that. But anytime the committee is finished, they shouldn't do it more than 30 days. That's the impression I have. But I'm very certain that we can do it as quickly as possible and let us have the report. So the 30 days is within 30 days. Yes, you may say that is too long, but I believe that they can work with, even before the 30 days. So let's all keep quiet and hold our breath and then wait and see what report they will come out. But I'm certain that this is going to solve this problem and they will have very good systems in place so that it doesn't happen again to anybody. Okay.
Doc, please hold for me. Also, Professor Titus Bayo, please hold for me. I'll come back to you. We've been joined by Dr. Otiko Ofisajaba, the former Minister for Gender and Social Protection, and I want to get to her in a bit, and I'll circle back to you, gentlemen. Doc, thank you for joining us this morning. I hope you're well.
I'm fine. Thank you very much.
Great.
And Baraka Salah.
Right.
You and your viewers.
Okay, Baraka de Salah. Now, Dr. Jaba, what do you make of this incident as reported? From your perspective as a woman and a former Gender and Social Protection Minister, how does this what is your assessment of this situation? We've not heard from you since this incident came to be. So what do you make of it?
Thank you very much. I am appalled. I am devastated because we are a community of Ghanaians. And the test of who we are, of civilization, is kindness and compassion. And when you are weak, that's when you need protection. When you're not well, that's when the hospitals come in. And so when this woman who has been involved in an accident is sent to a hospital, whatever the grade of the hospital is, and she's thrown out, abandoned in the bush, it's not about who is to blame. The system has failed. The hospital has failed. The community has failed. The social welfare has failed. All of us as a nation must bow our heads down in shame. We have lost a human being. She has died out of unkindness, out of wickedness. It was unnecessary. Where you have a problem and you go to the hospital and they can't identify you, the system has put in place where the social welfare and even the police can come together and investigate and find out where you come from. And so if they were able to find out that she came from this community, Ojobi, why go and leave her in the bush? Are there no people in Ojobi? And the people in Ojobi, when they found her in the bush, why did they leave her in the bush? Why didn't the chief or the assemblyman, these observers, take her into a home or back to the hospital? This is a serious failure. We should all bow our heads down in shame. I don't buy what the director is saying. He's trying to remove the blame from the hospital. But the hospital had no business abandoning her in the first place, because there's a system in place at all hospitals. And we have philanthropists where they are able to mobilize and get the social welfare to find people who can help. We've heard about it and read about it in the news of people who are not able to pay, and then the social welfare together with the hospital are able to find philanthropists to sort things out. So if you've taken care of her for 6 weeks, does that mean she should be abandoned
6 days,
and allowed to die as if she's an animal? What kind of society are we in this day and age, after so many years of independence, where we have a constitution that talks about protecting the people of this country? I am disgusted by the attitude, and there's no excuse for this behavior from the hospital or from the social welfare or the community. And where are her relatives? Did she not give birth to somebody? Does she not come from a family? And even if she didn't, and if the people in that community don't know her, and she's left in the bush, seriously, somebody, these young men watching, the woman who puts the cloth on her, should not have left her in the bush. So for the days that she was there, what was she eating?
All right.
What was she drinking?
Dr. Ojaba.
This is terrible.
Right. Now, you've said that the social welfare system has failed this woman. Dr. Nsiasari also said that the system has failed this woman. So 2 questions to you, and then I'll go back to the gentleman. Do you think that the social welfare system is well equipped to handle situations like this? And 2, is an investigation what we really need on this matter?
Yes, we need an investigation. I am not saying that it's only the social welfare. I say the social welfare, the hospital, Ministry of Health, and the community. They've all failed this woman. The social welfare is not properly equipped. You have about over 30,000 people to one social welfare officer. However, this issue is about an individual, an elderly woman who has had a problem. How many social welfare officers do you need to go and do that? It requires the district social welfare officer working with the hospital. They have a patient charter. They have ways that they work around with. And they should have been more serious. Instead of taking her out and leaving her, abandoning her in the bush. That is my problem. Okay. Whether you are well equipped or not, this is an emergency. This is an elderly woman who cannot take care of herself. She probably has dementia. She cannot remember where she is. My father had a similar problem. He got lost and we couldn't find him. It took the police, this was in England, to be able to find him and bring him back home. And that is what the system must do.
All right.
We owe it to every individual, especially the weak, to ensure that if you are a nation, a civilized nation, and you cannot protect the weak, then what is it all about? What is it all about after 67 years of independence? A woman dies like this. It's barbaric. It's a disgrace.
Doc, please hold for me. Let me go back to Professor Titus Bayo. Prof, I think, would you agree with me that the silence from the Ghana Medical Association on this issue is loud? We haven't heard anything from them. I mean, granted that the Ghana Health Service has launched an investigation into the matter, but the Ghana Medical Association, this falls right in their purview. They haven't said anything. Would you say that the silence is too loud?
I would agree with you on that statement. I think that the organization that I formerly worked for as its general secretary could or should have made a statement. The statement coming from the medical superintendent, he's a member of the association. I am hopeful, by the way our systems work, that by now they have made contact with him to get some briefing and know exactly what it is, and maybe to have come up with a statement. But to further say that I think that it's an entire systemic failure, and I agree with the former gender minister in a way. Because you see, the pathway Dr. Nsiansari described is practice. And in this day of social media, we have an additional arm in this pathway, which is that, and it's not uncommon for you to see even dead people. Someone is dead in the hospital and they do not know the relatives. They will put out their name and an image on social media trying to locate the relatives. This was not explored. Now, and I can't absolve the hospital of blame, not at all, because care must be continuous. And we always emphasize on continuum of care in our training of medical students. So if you are discharging someone from the hospital into the community, and we said that the patient is itching to be discharged, in fact, the statement leaves so many questions than answers. If you say the patient was itching to be discharged, what was the mental state of this patient? You yourself admit that this patient was aggressive, showing some confusion. Could it be that the patient had a mental issue, a pre-existing mental issue, the reason why she was knocked down? Is it that her injuries now has predisposed her to some hypoxia of the brain, and anybody in that state will exhibit confusion and delirium? Is that the situation, which could mean that her condition is getting worse? And so you don't focus only on the broken bones. So there are so many questions. Now, this lady was sent by an ambulance, accompanied by some people, according to this letter. When you got there as a trained professional, who were you handing the patient over to? When ambulance drivers bring patients to the hospital, they insist on getting a bed for the patient, even before they move to your hospital. When they get there, they insist that you take over the patient onto a hospital bed so they can send their stretcher away. So when they were dropping off this patient, who were they handing the patient over to? So was there not an option to have gone back if you get there and maybe the communication between the two social welfare people had failed? You got there, you were going to leave a patient, you get there, you cannot see the other social welfare person, or you see the person, but you cannot see a family, you cannot see anybody, someone on wheelchair with both legs cast. Is it sound to leave that patient by the roadside or in the bush? Is that where we hand over a patient to? So that is completely unacceptable. So was the hospital expecting this woman to come back for a review? Is it normal that tibial fractures will heal in 6 days? So was this woman supposed to come back? Come back from where? And who did they hand her over to? I think that's a critical question that the hospital cannot separate itself from blame. Now, when you come to the welfare, you have a social welfare officer in the hospital. You said you are linking up with the social welfare officer in the community. And then you are sending this patient back. Remember, you are not sending the patient back in the state in which she was before she came to hospital. Her legs were not cast in POP. She could walk and do everything on her own. So now that she's incapacitated, if you leave her by the roadside, who is she going to? Who is coming to her aid? So on that score, it's completely unacceptable. And one other option is this. Dr. Nsiansari also described the role of the chiefs, the community members, which I perfectly agree. But even if this patient is not from that community, sometimes they are sent to shelter homes. And we have a few of them in this country. Some built by religious organizations, philanthropists, and groups that care for people who are homeless. So at least this woman should have been kept in the care of someone who would have brought her subsequently back for a review. When was this POP going to be removed? If she's left in the bush, who would bring her back for the removal? So the hospital did not ensure continuum of care. The community, if they saw her there for 3 days, it's scandalous to say the least.
Right.
And to wait for her to die, even if she's not from that community, someone should have gone to the aid of this woman, at least reported the case to the police or get her back to hospital. So if you go there and you don't identify who she is, it's not a reason to abandon the woman. Could anybody there have reported to the assemblyman, to the chief, or anybody? And people are very quick to put things on social media. How come this never came up till the woman died? It's very unfortunate.
Well, it was on social media, actually, Prof. There was a lot of records on social media.
Prior to the woman dying? Or
yes.
After she died?
I actually saw it on social media, I think 2 days after it was reported on someone's Instagram that they had seen this, and so there were calls. I saw a lot of people saying, who did this? Who left the person there? And then next thing we know, she had died. So yes, it was actually on social media, which is why I asked about the silence of the GMA, because, so let me just ask the question. What do you make out of, what is there to infer from their silence? Is it about protecting the association? Is it about waiting to see what the investigations come up with before they say something? Why are they not speaking up? I mean, you used to be a general secretary, so just give me a sense of your thoughts on what could actually explain why they're silent.
Yeah, I can't hold brief for the GMA. I can't answer for them. I'm still a member of the GMA, but I do know that usually before we come out, we want to be briefed fully of all developments so that we come out with a very fair statement. And so I'm sure that the GMA by now, we have a regional executive in the central region where this hospital is. So the regional or divisional chairman, as we call, and the executives would have reached out to the hospital by now and should have been able to put some information together, enough for the association to come out. Definitely not for protection of individuals. The GMA does not condone unethical practices, and we caution our members always. But as you will notice, this does not involve only our member.
Right.
But the GMA is a mouthpiece for the entire health sector as well. And we advocate for the health of every single Ghanaian. And therefore, I think that maybe the delay might be because they haven't been adequately briefed. But for all this while, as I said, I cannot explain further.
Right.
What I will say is that while this is going on, we all, and the 30-day investigation period, I'm hoping that they will expedite action so that we get to the bottom of it before these 30 days. Because it simply means that this can happen to another human being somewhere within this 30-day period. It could be me. It could be you. It could be any of us on this platform. If I'm found in a village somewhere unconscious and no one knows me there, what is going to happen to me?
Right.
As a trainer of doctors, I always tell my medical students, when I train a doctor, I'm training the doctor because I think every doctor practicing in Ghana must be competent to take care of every patient. When you are unconscious, you cannot check who is taking care of you. You cannot ask, where did you train? You cannot ask, what is your qualification? So when you are at your lowest low, that is when you expect the system to save you.
All right.
So the entire system has failed this patient. And it's scandalous on our practice. It's scandalous on the nation. It's a scar on the conscience of this nation. In fact, I was in my village and I didn't hear this information early. The first person to give me this information was from the Netherlands. And the person just called me to say, do you see the reason why I said I don't want to live in Ghana? This is a Ghanaian. And I said, what's the problem? He said, how could a patient be abandoned in the bush to die? I said, it's not true. Send me the link. The person sent me the information. When I started reading it, I was like, this can't be true. I was in a state of denial until I saw a report from the medical superintendent. So this is completely unacceptable. All of us must bow our head in shame and make sure the next person doesn't suffer this, because death is so final. All that we will do now can never bring this patient back. Perhaps we may prevent another person from dying, and this is what we must do as a nation.
This could happen, I mean, the course of this 30-day investigation, this can happen to me, it can happen to you, it can happen to anyone. And Dr. Tiku was just saying how she's, really angered by the whole thing because this is someone who's weak. And in your time of weakness, that's when community or the country you live in should look after you. So the question is, beyond the investigation, Dr. Nsiasari, what shall we expect or what can we do to ensure that this is not a repeated action? We don't see another occurrence of this in the future, beyond the 30-day investigation.
I think beyond the 30 days investigation, we as a country, and I've already spoken to the management of Ghana Health Service, and even the teaching hospitals should all come together, especially the management of these hospitals. And we follow the patient charter to the letter. We should also have some training for every health management team to know what the responsibilities are. And I believe that this has brought forth what we lack as a nation in the continuum of care of all our patients. What I was thinking about is that even if the patient has a mental derangement, Uniba Hospital is not too far from Ankara. So there should have even be an arrangement with Ankafu Hospital that, look, I have a patient here. He said hit by somebody who didn't even take care of the patient. And the patient is in the hospital. We have done what we are supposed to do. So if possible, can I send this patient over to you to check the mental status and everything and make sure that the patient is well rehabilitated? But this is something which is, to me, it has happened.
Doc, your voice is a bit faint. Could you kindly speak up for us a bit?
What I'm saying is that we have to learn a very good lesson from what has happened. And it requires that we have to all sit down together and then have some training for all our hospital managers and make sure that they follow the rules and regulations to look at the patient charter, look at our discharge system, and then also follow-ups. Once you do that, then we can then say that when you are discharging the patient, you know exactly where the patient is going to. I've worked in some other communities outside this country where they even involve the religious organization. We want to make sure to know exactly which church that the patient goes to or which mosque that the patient go for service, and even contact the head of the religious organization in the hometown or anywhere else. And they normally kindly take over the management of this patient after discharge. And that's the reason why we have some homes, people have opened up some homes that they can accept all these patients. So if some small job has been done by the hospital management and then taking a bit of patience to make sure that all these things are done properly, we will not have had this unfortunate situation. But the most important thing, as both my sister Otiko and Kaitus have said, is we should learn a very good lesson from this and make sure that it doesn't happen again to anybody. So I'm praying that the committee will work very fast, come out of the results in the next 1 or 2 weeks or 3 weeks, and then make sure that whatever we see, we put it into practice in this country and make sure that we be a country where we take care of the patients and then take care of even the rehabilitation of wherever they are, and make sure they also come for even for reviews. Unfortunate situation, as everybody is seeing. When I heard it, I thought it was one of these social media. It's happening. But right. I never knew that it was real until I spoke to the medical director and then also some few people that I know in that region. And I clenched my teeth because if you look at it in any way, it shouldn't have happened. Okay. Especially if it was even a taxi who sent the patient to the community and then the taxi driver wants to go away. Yes, you can leave the patient anywhere. But for a hospital ambulance and for the social welfare officer, I understand you be accompanying the patient according to what you read to the town. You don't discharge the patient and leave the patient by the roadside. It's never done anyway. Unless the patient sees that he lives there with the relatives. Because even if that is the way, you have to know who is going to take care of a patient who has POP on both legs. The patient cannot walk. The patient cannot do anything for him or herself. So if you look at it in any way, it wasn't right. But okay. I'm praying that this thing doesn't happen again. Okay. And we learn very good lessons from whatever has happened. And the committee will have to come out with a very pragmatic solution to these issues. And I'm sure, I've seen the people who are on the committee, and they will do a very good job. So we shall all have patience to continue to follow up whatever is happening. And we hope that we will not end up in this situation again. I believe that the GMA, as you rightly said, they will come out. I think they do, because we normally come out for all these situations. We'll be speaking to the GMA president, and I'm sure very soon they will also come out with what they think. But we all agree, and they also agree that this is a very unfortunate situation. It didn't go very well, And I'm hoping that the social welfare department services will also set up and make sure that they work closely with the other colleagues in all hospitals to make sure that this thing doesn't happen again to anybody.
Okay. But, Doc, in addition to the training on discharge and follow-up and all these other actions that are, to ensure that this doesn't happen, what does any punitive measures look like for those who would emerge out of this investigation that were culpable, if we want to call this a crime? What would that look like? Losing their license to practice, sentencing even? What does punitive measures look like in this case?
You see, the health service has regulators. The doctors are regulated by Medical and Dental Council. Nurses are regulated by Nurses and Midwifery Council. And the Allied Health Council regulates the other allied health. So, with all these things, I'm sure the regulators are also looking on to find out exactly what the outcome will be and the appropriate actions if something went wrong by any individual. Then that action will be taken. But as I said, this is a system failure. So when I said a system failure, you cannot apportion the blame to an individual. It's the whole system. The whole system of discharge and follow-up has failed. All right. So we have to also be very careful about that we said that it's an indicator. But I agree with you that there's a head. That's the reason why I'm sure the Ghana Health Service Management has asked the head of the hospital to sit aside so that it doesn't influence the investigation which is ongoing. But the regulators are there. They are key. I'm sure they are watching. I've been a regulator before. I was a member of the Medical Council before. And we know how to deal with these situations. When there's
Thank you, Dr. Nsiah-Sarri. Let me come back to Dr. Otiko Ojaba now. I mean, Dr. Nsiah-Sarri is saying that training on discharge and follow-up and some other measures to ensure that we don't, see these issues coming up again. But what I want to find out from you is what should be done to enhance the effectiveness of our social welfare system to avoid such occurrences from happening?
Thank you very much. I agree with Dr. Nsiah that indeed we need more training, not only for social welfare, but also for hospital administrators. Being a doctor doesn't mean that you know how to handle administration. And so it's important that the whole medical system is retrained. I would ask that the association should put some funds into that, and the Ghana Health Service as well. The social welfare itself, apart from the training, also needs resources in terms of vehicles and laptops and what have you. And their involvement, because every hospital has a social welfare officer at the hospital. How they involve them is also very, very critical to ensure that this never happens again. The act that has occurred is highly irresponsible. And if you look at the Hippocratic Act, the oath that they swear, it talks about sympathy. So where was the sympathy of these people? We don't go to the hospital as if it's a beach. You go there because you are in need, you are ill, or a loved one or a friend or somebody is not well. And so it's incumbent on the system to protect everybody who goes there who is not well. And if you're not well trained, not necessarily in medicine, but in how to handle them. Okay. In Bekwaya, the Ministry of Gender has a destitute infirmary. I don't know if there are other infirmaries in every region, but I know of the Bekwaya one. And it's important that it is also better resourced, because when I was a minister, it was in a very poor state. There is the need for every region to have a destitute infirmary or to have an old people's home. And also the sensitization amongst our people that we are each other's keeper. And so if Akosua is lying in the bush, Akosua could be your mother. I told you, I have a personal interest in this because it happened to my father. If the police had not persevered and found us and found my father and brought him home, anything could have happened to him. And so in old age, we are very vulnerable. And all of us, including you, the media, including doctor, and everybody else, myself, we are getting to that age. We are already there. where we are very, very vulnerable and we need the system to be up and going. There is no excuse for what has happened. And the 30 days is too long. The suspension of the hospital administrator is in the right direction. We must see that justice is being done for this woman. Her relatives, where are they? The police must investigate and find them. She didn't come from a tree. This woman has lived a life. Who knows the type of life she lived as a younger person? And today that she's not well and she's vulnerable, she's been through an accident, nobody is coming out to claim her.
Okay.
Is it because she has no family? She has no child? She has nobody? And if she has nobody, the state of Ghana must take care of her. In her death, we are all talking plenty, but this death could have been avoided. And we must avoid it so that it doesn't happen again. And somebody must sue the hospital or the state for this act of negligence. In other dispensations, this would have happened. It's a huge loss to the nation. You know this woman's contributions to Mother Ghana.
Okay.
We must ensure that the hospital is working as it should. And GHS should not use bureaucracy. This issue about needing a bed for somebody else. Is she not also somebody else? Is she not a human being? If you need the bed and she cannot pay, do you leave her in the bush? That is an injustice, it's cruelty, it's against all human ethics. And it is against our society, who we are as Ghanaians. We cannot continue to allow this rubbish to go on. As somebody says, this nonsense must stop.
Okay, all right. Thank you so much. Let me come back to Professor Titus Bayo. But Prof, before I get your final words, I want to take your thoughts on this as well, since we're talking about health. And in fact, it's the same area, the same region. Cape Coast Teaching Hospital has suspended their hemodialysis service over maintenance. They're citing quality, assurance or something over that. Meanwhile, we understand the critical use of this service for people living with kidney problems. What do you make of the situation? And then you can give me your final words on the issue of the woman whose life was lost because of abandonment in the bush.
It's a worrying situation at Cape Coast, from what I have heard. And I don't know whether to call it politicization of our healthcare systems, which is very unfortunate. Because I think that a more detailed report should have come from the hospital on the reasons for the suspension, how long the suspension is being made, and the alternative arrangement they have made for the patient. Because remember, dialysis is a life-saving intervention. And for a person who needs dialysis today, it cannot wait till tomorrow. Any further delay could lead to death. And we know the reasons why. They can get uremic encephalopathy, they can become disoriented, they can die from volume overload because they cannot take out water. Several things can happen. So it's an emergency intervention, even for those on it for chronic reasons. And for that reason, I think the hospital should have come up with a more detailed explanation than what I am reading. What is happening? Is it an outbreak of an infection? Is there a problem there? What exactly is the issue? And this is not politics. This is about health. Anybody else could be there. So tell us what has happened. Tell us what you are doing about it. Tell us how long you expect this to be out and what contingency arrangement you've put in place. Because remember, not everybody going through this dialysis problem in Cape Coast has the capacity, for instance, to come to Accra or to go to the private sectors and other places for dialysis. So do they make contacts to the neighboring government dialysis facilities for help? Is there an arrangement in place to use ambulance to take these patients to the nearby region? From Cape Coast, you could come to Accra, you could go to Takrady. These facilities have dialysis services. If the hospital cares about the people, the hospital should take care of the cost of this movement of the regular patients they have on dialysis to the other centers so that they can have their dialysis. If not, you will end up solving your problem. And we have lost their lives. And I keep saying death is so final that when it happens, there's no remedial cause. Anything we do is for the next generation, not for that particular person. So that is my submission on that issue. The hospital needs to come out proper and not only tell us why they are breaking for whatever maintenance they are doing, but what are the contingency measures, knowing that for any of those people, they have a register of those who have dialysis there. shutting your doors, are you thinking about what is happening to them in their communities? So if you reopen in a week, half of the patients are dead. Do you care? So I think some arrangements should be made, even if it is with private facilities. The government policy on dialysis that they have come in, they must quickly make arrangement with these facilities such that there is no disruption of care, because for these people, it's a matter of life and death.
Right.
On the woman's situation, I would say that I would blame all of us for what has happened, but I want to plead with the media. Everybody in Ghana is most vulnerable when you need an emergency care and critical care in this country. This is something I've made a lot of noise about, but we seem not to be paying attention to it. A 72-year-old man, or I don't remember the age well, died from lack of bed, no bed syndrome. It was noise. I'm yet to hear any media house go back to test the system to see. Send in some mystery shoppers, report at an odd hour in some hospitals, and see what the situation currently is. Sometimes at the weekend, I am inundated by calls from people trying to find an ICU bed from hospital to hospital. People going to emergency and told no bed, and they are waiting somewhere. So these things are still happening. Yet, once nobody has died, we've gone to sleep. Until someone else dies, then it becomes news, and then we all come up. I'm saying this in relation to this woman's situation because this very thing that we are seeing as very despicable, condemnable, should never have happened. May happen to someone else, and indeed may have been happening to other people, just that it's not reported. So I am pleading with the media not to go silent on this in about 2-3 weeks. We should follow this to the end, get the final report, know what has happened, and at the end, from time to time, check the system readiness. If someone has a similar thing, what is going to happen to the person? I think this is very, very important. You also asked about the punitive action. They can run from administrative, where people may be relieved of management positions. So the system that is going through the investigation now, the Ghana Health Service, can take administrative actions on people that work within its facility, from suspension, from dismissal, from relieving of posts, and all of that. When it comes to the issue of licenses, like Dr. Nsiansari mentioned, it has to be with the regulatory bodies. This investigative body currently can make reference to the various investigative bodies, various regulatory bodies, i.e. the Medical and Dental Council, the Allied Health Council, the Nursing and Midwifery Council, to take actions on these. And if they even suspect criminality, report can subsequently be made to the police. But remember, the focus is not just to punish people. How can we make sure that this does not happen to the next patient?
Right.
If someone is found unconscious somewhere. My last take on it will be to the ordinary Ghanaian. Please, taking your picture and putting it on social media does not solve the situation. And that is a new worrying trend I am seeing. Somebody collapses, the first thing people pull out their phone, take pictures, and they are sharing. Whether to get more likes, I'm not sure. You see an accident scene, and instead of rushing to save people, then the first thing is people are filming it, and no one is actually caring. While your filming may draw attention to this matter, there are immediate actions we can all take as a society when we find someone helpless. Just remember, it could be you, or your relative, or your friend. So what is the most logical step you can take in any situation?
Right.
Is it just filming it? I don't think so. All of us should think about this. Thank you.
Thank you, Professor Titus Bayo. Now, Dr. Anthony Nsiansari, your final words. But since I have you here, I'd like to get what your appreciation of this suspension of the Cape Coast dialysis service over maintenance work is. And then you can give me your final take on the issue about the woman who's lost her life due to abandonment.
Yeah, thank you very much. Yes, the Cape Coast chief executive spoke to me, I think about 3 or 4 days ago, that they were doing some checks on their machine. And I thought, I haven't heard from him again, I thought it has been sorted out because he was talking about carbonate and all these things, because they were getting patients who, after dialysis, started running fever of rivals and the rest, which is in order. I mean, if the system you are using is bringing out some adverse reactions. You have to stop and check and see what it is. But I thought it has been sorted out. I will find out exactly what the situation is. But as the title said, if that's the case, you should have a way of also connecting to Takrade. I know has some dialysis machines, Accra has some dialysis machines, so that acute patients can be taken care of and the chronic patients can also be redistributed to continue their dialysis whilst they put their systems in place. So that I'm sure the number of people who are going there for chronic cases who are going there for dialysis, maybe they have discussed with them. Maybe that's the reason. I'm not going to do for them. But after this discussion, I'll find out what the situation is if they haven't sorted it out, when are they going to sort it out. So that's the situation.
Okay.
But as a country, we will come out with a very comprehensive way of solving these chronic disease issues once for all, so that it's not only about dialysis, but it's also about other ways of making sure that chronic kidney diseases are prevented, early detected, early managed, so that they don't end up even in dialysis. And then we get some dialysis machines across the country so that nobody moves from one region to the other region or district to another district. And also make sure that we have the end treatment of all chronic kidney diseases like transplantation, kidney transplantation. Now, if once you want to do that, you have to get a law for tissue and organ donation and transplantation, which the Ministry of Health has a document that they are working on to go to Attorney General Department, Cabinet, and then Parliament to pass the law. So that's what I would say about the dialysis. But for this unfortunate situation, as I said, we are all holding our breath and making sure that the investigation body will come out with definitive solutions to this problem. And I believe it's very unfortunate that this thing happened, but I believe that's going to be the beginning of a very well-crafted system where the social welfare, both the hospital and also in the community will work together, where every member of the community becomes the brothers or the sisters keeper, where we also will think more about each other. When especially we find somebody in a situation like somebody in a wheelchair sitting by the roadside or in the bush, the most immediate thing that anybody should do is not to take a picture and put on social media, but report to the police. I'm sure Ojobi has a police station, so the patient will be quickly picked, and the investigation will start quickly. And patient please in the nearest hospital or health facility, so that the patient doesn't lose his or her life, as we have seen in this situation.
All right.
So I'm certain, and we'll be following up to make sure that the committee works very fast, so that they come out with the solutions that we all need. And it's very unfortunate, but we believe that the system will have to be put well in place. People trained, not only the hospital management staff, also even the community, that we gather together, the assemblymen and then also the chiefs, and talk to them what they are supposed to do in both of the situations. Because hitherto, people take people and put in their hopes and take care of them when they don't know where they are coming from, until they are well and can become meaningful to the society. So I'll say that it's a very unfortunate situation. Hope it doesn't happen again. And I'm very certain, I've worked in Ghana Health Service before, that anybody who is found culpable will also be taken through the system and make sure that administrative issues are all sorted out accordingly.
Thank you so much, Dr. Anthony Siasari. Now, Dr. Otiko Jaba, bring us home in about 30 seconds to 1 minute.
What I want to say is that the greatness of a nation can be judged or measured by how it treats its weakest members. And the weakest members are the children, the women, the persons with disability, and the elderly. If we are to say that we are a civilized nation, then it is incumbent on us to be a society that is kind and compassionate. We must ensure that in our communities, we are handling each other as brothers and sisters. With the hospital, there must be peer review, constant monitoring, and auditing of the activities of medical professionals. Like I said, the hospital is not a beach. It's not for entertainment. It's for pain and getting solutions. And so hospital and medical officers must also remember their oath and their contract to the people, that they must treat us out of kindness and compassion, because when you are ill, you are most vulnerable. And never again must this happen. It should not be a 9-day wonder that we'll talk about it. This investigation must even be made public on television for us to see. And it must be done in 7 days, not in 30 days. A woman has lost her life. A woman has lost her life. A mother, a contributor of this great nation. It is negligence, it is irresponsibility, and it is unacceptable. It is barbaric, and we as a nation must stop talking and take action. When you see people like the doctor said, Bayo, you don't go taking pictures. Why didn't somebody give her food? After giving her the cloth, she can't walk. How is she supposed to get food or water for herself? And she lies there for days and dies like an animal. We should all bow down our heads in shame. Being strong means that you are able to take care of the weak.
Right.
Because let's learn to be kind and compassionate in this country and be humane. And somebody should sue this hospital, and the doctors should all be caned for negligence. Thank you very much.
Thank you so much, Dr. Otiko Jaba, former Minister for Gender, Children and Social Protection. I was also joined by Dr. Anthony Siasari, Presidential Advisor on Health and former CEO of Komfanoche Teaching Hospital, and Professor Titus Bayo, Professor at the University of Ghana Medical School and former General Secretary of the Ghana Medical Association, all joined me to get into this topic of this unfortunate incident. Whatever, it's unimaginable to think the ordeal this woman went through leading up to her death, whether snakes, she was at the mercy of snakes, whatever that happened to this woman, it should be on each and every one of our conscience as Ghanaians, because we are all collectively responsible for it. But that's all time will allow us for this belt of conversation. Coming up next, 3 persons dead in the Wild West district following a renewed communal conflict over chieftaincy between the people of Kendu and Lasia Otolu in the Wild West district of the Upper West region. We'll take you there for the current situation, for assessment and some updates coming up next on the AM show. I'll be right back.